Well, these are unsettling times for healthcare professionals, as you can imagine. What's going through their minds as they face this pandemic head on? A surgeon at Hartford HealthCare puts the experience into her own words. Take a look.
I am a surgeon, I'm a mother, I'm a wife, I'm a daughter, I'm a sister, and I absolutely expect to get sick. And I can only hope that I get a mild case of it, but I have no doubt that it will happen at some point. But, you know, you always want to be one of the helpers, and in this kind of a job, that's my responsibility. But if I were to get really, really sick and things were to get bad, I would want my children to know that I have taken an oath to serve my community and to help my patients. And so even in this pandemic, I still uphold that oath. I don't think I've ever been more proud to be amongst this group, to be a physician. And we are all in this together.
Wow, and joining us now live from Hartford HealthCare Studios is that Dr. Niamey Wilson. She's the Director of Breast Surgery Research and Quality at Hartford HealthCare Cancer Institute. Doctor, thank you for being with us. That was so powerful.
Thank you. Yes, a filmmaker contacted me to produce that because, you know, we don't really see the backstory of some of what the doctors and nurses are going through, so we thought it would be a good moment to do that.
Take us inside, and what is the emotional state of those in the hospital taking care of these very sick patients?
Yeah, it's challenging. I think one of the biggest things that we're struggling with is just this new normal that none of us were really prepared for. If you look at, you know, the medical system just last year, 2 years ago, we're very used to a high-touch environment, lots of hugging, lots of communication. We're not used to all these barriers and having, you know, the same diagnosis for patients coming in very, very sick. So it's been very challenging for the doctors and the nurses and the entire healthcare team as well.
I can only imagine. You guys are amazing. So let's talk about how the patients are handling it with telehealth. I'm hearing some very touching stories about how you're kind of their family there since they can't have visitors.
Yeah, it's a strange kind of time to have a visit or even a surgery. Telehealth has been going really, really well. We have been doing a lot of our visits online and with video chat and things like that. But for patients who have to come into the hospital, for example, if somebody's having surgery, they can't come in with a family member. So, you know, they get dropped off at the curb. One of the nurses comes and gets them, brings them into the pre-op area. They have their surgery, and then after they wake up in the recovery room and they're ready to go, the nurse wheels them back out to the curb to, you know, be picked up by their family member, it's just a strange scenario. So we're trying to be with them as much as possible and let them know that we've got their back.
Oh, that's so great for so many people to hear. How about the patients? Do they seem to understand or that these changes are necessary? Do they get upset? Tell us about that.
Yeah, they do seem to understand. You know, they understand that that we're trying to protect them. We don't want them coming into the hospital or any medical facility if they could be put at risk. So, and they also understand that we're trying to limit the use of our protective equipment and so forth. So, I would say for the most part, people have been wonderful, and everybody knows that we're all just doing this together to protect each other as much as possible.
And your husband is also a physician, and your parents, how are you handling this and juggling it?
Yeah, we have 3 small children, and we both go to work every day at our respective hospitals. So we have a fabulous nanny who takes care of our children. We love her to death. She puts herself at risk every day just by coming to work, and so we owe her a million thanks for that. But, you know, our kids understand that we go to work. We have to take care of our patients, and we are committed to doing that. And so I'm glad they get to see that side of it, too.
Oh, Dr. Wilson, thank you so much for joining us. And you're heroes. It's amazing what you're doing. Keep up the great work. Thank you.
Thank you so much.